Hi, everyone, and welcome back to TIME100 Talks. I'm Edward Felsenthal, Editor-in-Chief and CEO of Time. If you haven't joined us before, TIME100 Talks is our new live event series where we bring together extraordinary leaders from across fields and around the world to spotlight solutions and encourage action toward a better world. Today, we're going to focus in depth on the issue of equality in the era of COVID-19. This crisis has not affected everyone equally. We know that the impact is disproportionate on marginalized communities, that there are groups whose jobs and health are at greater risk than other groups. This is the first of 3 talks in which we're going to tackle these issues and explore how, as we rebuild and recalibrate, we can build a more resilient and more just world. We're joined today by the Prime Minister of Iceland, Katrín Jakobsdóttir, who will be interviewed by Katie Couric. Iceland has been ahead of the curve in mitigating the spread of COVID-19. We have former FDA Commissioner Scott Gottlieb with us, Fair Fight Action founder Stacey Abrams, the co-founders of Water.org and Water Equity, Matt Damon and Gary White, who will be interviewed by Van Jones. I'd like to thank our partner, P&G, for making today's talks and the following talks on equity possible. And before we get started, I'd like to introduce the Grammy, Tony, and Emmy Award winner, Ben Platt, who will do a performance for us now, his new single, So Will I.
You say, what if I go crazy? I say, that ain't gonna happen. You say, what if I get lost? I say, you'll just find your way back. And you say, what if someone breaks my heart? I'll put it back together like I do. You say, what if I don't catch the dreams that I've been out there chasing? What if when my fears show up, I'm too afraid to face them? Well, I can't fight your battles, but I sure can hold your hand and promise you that the sky will still be up there and the sun will always shine. The stars will keep on falling for the ones who wish at night. The mountains won't start moving and the rivers won't run dry. The world will always be there, and so will I. You say, what if things start changing? I say, we'll be changing with them. We'll just sing a different melody and dance a different rhythm. You say, what if I give up? I say, that's one thing that I'll never let you do. You say, what if someone leaves me and they leave me empty-handed? I say, losing only teaches you to not take things for granted. No, I can't just bring them back, but darling, I can hold your hand and promise you that the sky will still be up there and the sun will always shine. The stars will keep on falling for the ones who wish at night. The mountains won't start moving and the rivers won't run dry. The world will always be there, and so will I. And so will I. Oh, If the stars we used to wish on disappear into the night, well, I can move a mountain, but only by your side. Just say you'll always be there. I know you'll always be there. And so will I.
Thank you, Ben, for that amazing performance. We look forward to speaking with you later in the event. And now I'd like to introduce my colleague, Molly Ball, national political correspondent for Time. Molly will be speaking with the founder of Fair Fight Action, Stacey Abrams, about her work on voting rights in the midst of the pandemic, the upcoming elections, and more. Molly?
Thank you, Edward. I am so pleased to be joined today by Stacey Abrams, who, in addition to being the founder of Fair Fight and Fair Count, is the former Democratic leader of the Georgia State House and former Democratic gubernatorial nominee. Leader Abrams, thank you so much for being here with us.
Thank you for having me.
So so where is here for you? Where are you right now?
I'm in the dining room / studio of my townhouse in Georgia.
And I know from our interviews that you're a woman of many interests, from Star Trek to car racing. Have you picked up any new hobbies, started any new projects during your time indoors?
Well, I finished a book, so that's a good thing. Although, I'm looking forward to reading the one that's right behind you. And absolutely. No, I've got a stack of reading I want to get to, but other than that, just continuing to catch up on TV and do some deep reading and write when I can.
Yeah. Well, so let's turn to some local news out of Georgia. I want to talk to you about Ahmaud Arbery. You previously called his death a murder. It seems that it's now actually being prosecuted as such. How do you rate the state's handling of the case?
I begin by saying that it's a travesty that it took 74 days to get attention brought to his murder. And that meant that a group of us had to elevate it to national attention in order to secure even local reaction. But I think what's happened since, the willingness of the Georgia Bureau of Investigation to step in and to do what the DA in Glenn County refused to do, as well as one of her colleagues down in South Georgia. And more importantly, the attention that's being given to ensuring not only that the case is adjudicated appropriately, but also that we take legislative action to respond to what put him in jeopardy in the first place. It's hate crimes legislation, which will address the penalty of the crime that was committed, but we also need to look at stand your ground laws, citizens arrest, and the criminalization of young Black men and Black people in the state of Georgia and around the country. And so we're working very hard with the coalition of organizations and the Arbery family to ensure that his death is not in vain and that the justice that they seek is actually accrued not simply through the prosecution of his murderers, but through changing the laws that made his murder possible.
And how about the governor's handling of the case? Do you think he's done the right thing here?
Once he became engaged, I think that the speed with which reaction and action is taken is important, but I can't divorce that from the fact that he's also pushing legislation in the General Assembly that will recriminalize juveniles and once again create the atmosphere in Georgia that we should pursue prosecution of young people instead of trying to make sure that we're doing the education and intervention that can make certain that they are taken care of, but also reshaping the narrative in Georgia so that Black men aren't seen as dangerous, they're seen as human and as citizens.
How about the governor's handling of the coronavirus? He's come under a lot of criticism for his aggressive reopening timeline. What would you have done differently?
Well, I spent the last few weeks talking about what should have been, what should have happened, in part because what he did was not based on facts. It wasn't based on science. And unfortunately, what we have discovered has continued is a misuse, if not misappropriation of data. Number one, Georgia should have much earlier gone into shelter in place. That we were one of the last states to take that action. We're one of the largest states in the nation. And that meant you had a hodgepodge of reactions and solutions that were being put in place by county officials and mayors. We then became one of the first states to come out of shelter in place. despite the fact that our numbers were continuing to rise and without clear direction to owners of small businesses about what could be done. And then fortunately in the state of Georgia, we know that the low-income workers who were compelled to go back to work did not have the option of saying no, despite the propaganda, because we're a right-to-work state. If a boss tells you to come to work and you refuse, they have the right to terminate you. And so we found the most vulnerable workers being put on the front lines without the protections. And we're in a state where we do not have Medicaid expansion. And so they not only risk their lives, their livelihoods, they risk their lives without necessarily knowing that there would be a benefit and the opportunity to get help. But the last piece, and the part that's the most disturbing, is the fact that we have watched in recent days a manipulation of data that pretends that Georgia is doing better than it is. This is a state where more than half of the deaths from COVID-19 are happening among African Americans. We're 34% of the cases, and we're only 32% of the population. There has not been enough attention, and there certainly hasn't been enough effort on the part of the governor to protect the state of Georgia, especially those who are the most vulnerable and the least resilient to this disease.
So what do you think is the way to move forward from here?
I think it's too late now to unring the bell he's rung, but what will have to happen is that we are prepared for the next wave of COVID, which is absolutely going to come. We know from the science, we know from the numbers that Georgia is going to experience another wave. And when that happens, we have to move quickly to shelter in place where we can, to get testing out, but also to make sure our contact tracing is more appropriately leveled up, and that we have access to the medical facilities that we need. Georgia is one of the states that refuses to expand Medicaid, which means we have a shortage of doctors and nurses. And we know that one of the symptoms of COVID-19 and one of the aftermaths is that people don't simply recover. They're left with up to 30% less lung capacity, which means you have semi-disabled people now who are part of what's left in the wake of COVID-19. We do not have a plan of action for how we're going to address the healthcare needs. In fact, to the contrary, the governor has proposed a massive cut to Medicaid in the state of Georgia as part of his budget. And so we need to make certain that when COVID hits again, that we are prepared to serve the people who need it, and that we do not falsely jumpstart our economy at the expense of our people.
I want to talk about your organization, Fair Fight, which you founded to fight threats to voting rights. Has the pandemic totally upended that mission? Has it changed everything? What has or hasn't changed about your work in that regard?
Well, unfortunately or fortunately, we anticipated there would be something catastrophic that happened in the 2020 election. I did not anticipate it would be a pandemic that shut down the world, but we knew that in the United States there would be some action taken, likely by the purveyors of voter suppression, that would push us into an unprecedented posture. And it happened. But luckily, because of our structure, we were ready to meet the challenge. We launched Fair Fight 2020 in 2019 so we could be in place in every state where we're operating by their presidential primary. Because we have been able to do so, we've been able to react moment to moment, and we've been able to shift our strategies. Where we were initially focusing on building the infrastructure for examining and responding to voter suppression tactics in each state, we now have a unified mission of trying to ensure that vote by mail is available to every eligible American in this country. If we can get vote by mail, if we can remove the barriers, if we can increase access, then what we can do is actually thin out the lines so that those who need to vote in person are the only ones who show up. We should all look at what happened in Wisconsin as both a travesty and a tragedy, but it's also a cautionary tale. We have the capacity to solve for that, to make certain that people don't contract the disease trying to exercise their most fundamental right, which is the right to vote. And because we were in place in Wisconsin, we were able to help deploy volunteers to answer phone calls, to help voters understand what was at stake. We were able to help the state party respond to the whiplash of decisions that were coming out of the state and out of the Supreme Court. But we were also able to help them prepare for what's next. And we're doing that in 18 states, covering more than 100 million voters. That means that we are on the ground doing the work now, preparing for 2020. And in light of the recent revelations that Republicans are planning to deploy 50,000 poll observers to intimidate voters, they're planning to build a $60 million war chest to beat back against expansion of the right to vote, and that they're creating this false narrative of voter fraud in order to scare people out of using their fundamental rights as Americans. We are ready to meet that challenge, and luckily we were built for this fight.
Is there any way in which the current state of affairs has actually shed a light on this, or even jump-started some of these reforms by focusing people on the need for ballot access for people who can't get to the polls?
Absolutely. Part of voter suppression's effectiveness is the fact that you have these labyrinthine rules that differ from state to state. It was only because of Wisconsin that people realized that vote by mail is not accessible in every state. There are 39 states that have no excuses absentee balloting, but in the remaining states, those are hurdles for people who need to be able to vote. And in Wisconsin, people finally realized that just because you have it where you live doesn't mean everyone does. Number two, we were able to uncover for the general public some of the challenges like signature mismatch laws. This is essentially a law that says that your signature has to look the same when you sign the back of your absentee ballot as it did the last time you signed a piece of paper, which could have been 10, 20 years ago. And that forensic notion, that forensic countermeasure against voter misinformation is actually flawed. It's junk science, but now people know that they have this challenge they weren't aware of. We have 10 states that require that you have a witness or a notary. And I dare anyone to find a notary public right now to validate the back of their ballot. And so while we have been raising the issue of voter suppression for months, in fact, for the last year and a half, what this has put into sharp relief is just how hard it can be for the average person to cast a ballot in ways that most people do not understand unless they try to use a different system than the one they're used to.
Well, and you were obviously partly inspired by what you went through in Georgia, and Georgia still has a primary coming up, if I'm not mistaken. How is that looking? How's Georgia doing on this?
Georgia's doing pretty good. We have, we were able to reach a bipartisan agreement with the Secretary of State to send out 6.9 million absentee ballot applications to active voters. Of course, the flaw in that is that did not go to new registrants, and it did not go to anyone who was considered inactive because they've missed recent elections. But the important piece is that it shows that this is a bipartisan opportunity. We also identified some challenges. One is that Georgia does not send a stamp. So when you try to return your application or return your ballot, you've got to find a post office that's open or a grocery store that's selling stamps. And that's difficult, especially in rural communities or in low-income communities. And so Georgia has done a better job than a number of states, but we still have some challenges we need to meet. Luckily, we've been able to either work it out by negotiation or by litigation, but we're making progress. We have had more than 1.5 million Georgians actually apply for those absentee ballots. And early voting started yesterday, which is another gold standard. We want not only for people to be able to vote by mail, but people who need to be able to vote in person should be able to. And in Georgia, in every county, you have to have early voting. And those early voting locations allow people who don't have options to cast their ballots. And by the time we get to Election Day, those who need to vote in person, those who are homeless, those who have been displaced, those who are disabled, those who have language barriers, or those for whom voting by mail simply didn't work, they'll be able to safely access the ballot and safely access the voting location so they can cast their votes.
Well, of course, none of us know exactly what things are going to look like with regard to the virus when we get to November. Last week in this venue, Jared Kushner told my colleague Brian Bennett that he wasn't sure he could commit to holding the election on November 3rd.
Is there any scenario, including a second outbreak in the fall, where the elections move past November 3rd?
That's too far in the future to tell. Nothing that I'm aware of now, but again, our focus right now is just on getting the country.
Will you commit that the elections will happen on November 3rd?
It's not my decision to make, so I'm not sure I can commit one way or the other.
Can you foresee any situation where it might be prudent to move the election date?
No. It's not only there's not only constitutional hurdles to change the election date, there are also legislative hurdles, and I'm fairly certain that we will not find common agreement between the House and the Senate on changing the election date. And so we have to prepare for November 3rd to be the date of the election. But what that means is that we have to understand the bureaucracy that goes into holding an election. One of the challenges facing Wisconsin, facing Georgia, facing Ohio, was that they had to shift how people access their ballots. And because of that, the sheer scale of provision of absentee ballots is going to tax the resources of states through no fault of their own. That means that the federal government, through the HEROES Act, has to act quickly to get the resources to states. And my hope is that Jared Kushner and others will focus on making certain that our democracy functions in November, as opposed to creating some mythology that it can change. The last thing I'll say is that the nation of South Korea experienced their first moments of COVID-19 at the same time as the United States. And on April 15th, President Moon oversaw a nationwide election, which had the highest voter turnout in 30 years. If South Korea can do that, the United States can. And South Korea had very little time to prepare. We've got 6 months. We know when the election is. We know it has to happen. What we're missing is the commitment of the US Senate to invest in our states and to ensure that our democracy continues to function.
So about that presidential election, you have not been coy about your interest in being considered for the Democratic ticket. And some people have called that a little bit presumptuous. How do you respond to that?
I have been answering the same question for 14 months. It started in March of 2019. And if you track every single response I've given, it has always been the same. I recognize that it is, now that we have a nominee, it is Vice President Biden's absolute decision who he chooses to as his partner. He alone knows what he's looking for, and he has a smart team that will help him make the best choice. What I've responded to has been the question of whether I believe I should stand for it if I'm invited, and whether I can. And as a woman of color, I think about the women who are looking at me, the young women of color, those who've been told to hide their interest and pretend through coyness that they don't have ambition. My ambition is to serve. I live in a state where people are dying because of failed leadership. I live in a nation where we have an opportunity to either recover from this tragedy or to continue to sink into a malaise, and I want us to do better. I believe that Joe Biden is the right person for this moment. I believe his empathy, his competence, and his leadership is what we need. And I encourage anyone who wants to see this country be stronger to get behind his candidacy. My question is always, the question I get is, would I be willing to help? My answer is absolutely yes. And it's going to be my commitment, regardless of the decision of the Biden campaign, that I'm going to do everything in my power to make certain he's the next president of the United States.
Do you think that a man would be criticized in the same way for being open about his ambition?
No.
Biden has called himself a transitional figure. Do you think that heightens the stakes for whoever he chooses to be his partner on the ticket?
On day one, Joe Biden will be the president of the United States. We are electing our leader, and his leadership is what we should be looking to and what we should be thinking about. There is no shortage of qualified people who can serve as his lieutenant, and that should be absolutely his decision because he's the only person in this conversation who's done that job. And so I trust that he's going to pick the right person for him, but we should not elide the notion that he is going to be the person who holds that office on day one, and everything we do should be about making certain that he has the capacity and has the support from our country to make him the next president of the United States.
You and many other Democrats have said you believe Joe Biden when he denies sexually assaulting Tara Reade. What message do you think it sends to survivors of sexual abuse when a powerful man's friends all gather around and defend him from an accusation like that?
I would start with the premise that we need to understand that survivor justice should be separated from any questions of politics. Women deserve to be heard. They deserve to have their allegations investigated. Survivors deserve a process that doesn't rely on politics or the press to adjudicate the legitimacy of their claims or their need for actual due process. That said, I believe Joe Biden because I know him and because I, having read and understood the allegations, do not find them to be credible. They did not change my opinion of him, and I support him. But as he has said, he directly addressed these issues. He has directly addressed the question. And as he said, if there is anyone who doesn't believe him, they should vote their conscience and vote their heart. I stand behind my decision, and I just stand behind it as someone who is an American, who has the responsibility to determine the kind of leadership I wish to see. And I trust Joe Biden. He is someone who has stood for women and stood with women, and I believe him on this issue.
Well, how about the conduct that he's admitted to, the unwanted touching that has made numerous women uncomfortable? Why isn't that an issue?
He apologized for that behavior, and he has promised to remedy it. And if you look at the last 12 months, there has not been a single accusation of that conduct. I don't think that even if you listen to those who were concerned about it, there was never a question of whether he was sexually harassing, but it was uncomfortable and it was discomforting. He acknowledged that and he promised better behavior. I believe that he has done what he said he would do. And that's one of the reasons I so strongly support his leadership for our country, because this is a man who knows how to take accountability. He knows how to take responsibility. He has directly addressed the challenges. And unlike the current president, he has not shied away from taking direct responsibility and responding to accusations. But more importantly, he has talked about creating a process so that no survivor of any type of assault would ever have to hide or be afraid to come forward.
There's a big debate among Democrats about what the winning message is in this election, particularly against Donald Trump, but also in general. What do you think is the right message for both, winning swing voters and particularly for those marginalized voters that you've been so focused on activating? What do you think they need to hear?
This is an election about competence and about courage. Donald Trump is incompetent. He has mismanaged every major challenge this nation has faced in 4 years. But he's also a coward who has refused to take responsibility for his actions, for his inactions, and for his mistakes. But more than that, we are a nation that deserves to be seen in our full glory, meaning that every person is seen and valued. Every person has an opportunity for success. And for those who are facing the harshest effects of COVID-19, that is largely communities of color, largely poor communities, they need to know that the leader of this country sees them, trusts them, and wants them to be successful. That's why Joe Biden is the only person who's talking about how we address healthcare, how we address the fracturing of our economy, how we make certain that when we recover, we do it right. This is a man who has demonstrated the competence to recover from the kind of economic depression we're in right now, because he did it under President Obama. But he's also someone who understands the global health security challenges that we face, because COVID-19 is not going to suddenly disappear. And he was the person who helped spearhead the global health security system that Donald Trump dismantled. This is a man who is competent and he's a man of courage. He admits mistakes. He talks about what can be done to remedy those mistakes. But more importantly, he has a vision for an America that is stronger than we are today. And that's the kind of leadership we need. That conversation has to be had at every level, and we cannot take any voters for granted. And I'm very excited that the president or the vice president and his team are talking about an expanded map, that we're not simply going to relitigate the 2016 election, but that we understand that we're also running the 2010 election, where we're going to make determinations about the next decade of leadership, the next decade of congressional leadership, as well as state and local leadership. He understands that we have to have the broadest vision for America, and he's willing to put his resources and his campaign behind it.
Are you willing to predict today that Joe Biden will or won't win Georgia?
He will win Georgia.
Wow. All right. Well, on that note, thank you so much, Leader Stacey Abrams, for joining us today.
Thank you, Molly, for having me.
And now I'd like to introduce my colleague, Alice Park, Time's senior health correspondent. She'll be joined by former FDA Commissioner Dr. Scott Gottlieb and physician and public health advocate Dr. Lena Wen.
Thanks, Molly. I'm Alice Park, and I'm so happy to be joined today by Dr. Lena Wen and Dr. Scott Gottlieb. Dr. Wen is an emergency physician and visiting professor at George Washington University Milken School of Public Health. She is also former health commissioner for the city of Baltimore. Dr. Scott Gottlieb is resident fellow at the American Enterprise Institute and led the Food and Drug Administration from 2017 to 2019. Welcome, both of you, to this Time 100 Talks.
Thanks.
Thank you.
I'd like to ask both of you, as you observe this pandemic unfold and watch the political and public health responses, Dr. Wen, let's start with you. Does a part of you wish that you were still health commissioner in Baltimore?
Yes, I'm an emergency physician and I'm trained to be on the front lines. I still practice clinical medicine, and so I'm glad to be on the front lines in that respect. But this is what all of us who are public health experts have trained to do, really all of our lives, all of our professional lives at least. And I think all of us in this time are trying to do our part. I see my colleagues who are the local health officials, state health officials doing their best to serve the residents and protect their health and well-being all across the country. And I wish I could join them there, although I think I and Dr. Gottlieb and others are also doing our part to be public health communicators, to do research and policy analysis, and really just to contribute our part at this time that we're really in this all together.
Yeah, look,
Gottlieb, thank you. Do you wish you were still there at the FDA?
Same sentiments. I mean, obviously, I wish I was there. I mean, spent a lot of time working on pandemic preparedness in the years leading up to this, back in 03 and 05 when I was at FDA, and we were worried about a pandemic flu at that point, worried about a bird flu. But certainly wish I was back at FDA with my colleagues to help lead the agency through this.
And since both of you have served in public office, I'd like to get your perspective on the push and pull between politics and public health that we're seeing played out in the country today. Does that concern you? And is this kind of tension inevitable, or is it avoidable? Dr. Wen, let's start with you.
Public health hinges on public trust. I am very concerned about what we're seeing with the politicization of health and medicine. So many of the things that we ask people to do at times of public health crises relies on that public trust. If we're asking people to change their behavior fundamentally, to do things like sheltering in place and not go to work, not see their friends for prolonged periods of time, or we're asking people for their contacts and everywhere that they've been and to go get tested and to be isolated for a period of time. I mean, all of these are quite extraordinary measures. And it does depend on the public's trust in government institutions, public trust in science and medicine. And I do fear that so much of the rhetoric now somehow pits public health against the economy, or pits public health against some other entity, politics, or some partisan goal. And I really worry about what that means, because ultimately it ends up compromising people's health. When we don't follow the science, we pay the price.
Well, look, I think the public health issues can transcend politics if public health leaders are doing a good job trying to explain the goals to policymakers and also explain the goals of what we're doing to the public. Where I worry about it is things like, you look at contact tracing, for example. There's a lot of discussion about contact tracing and whether that constitutes the government being too intrusive into people's lives. If we don't get to effective case-based interventions and get to a place where we can do very effective contact tracing in the fall, it's going to be very hard to contain this virus and prevent outbreaks and epidemics in the fall. And that's gotten sort of mixed up into a policy context and sort of a policy debate about what the proper role of government it is and whether or not that's too expansive of a role for government. And that's where I start to get concerned that some of these sort of basic public health interventions and public health considerations are getting swept up into a policy debate or a political context. And I think that can be you can transcend that if you're communicating effectively, if you're talking to the public effectively about what things are and are not, what the goals are, and that's the job of public health leaders in these roles during this time of crisis.
And Dr. Gottlieb, you just mentioned, how looking toward the fall and what that will look like. We're now in the midst of reopening, with every state already opening different parts of various businesses. You submitted a letter to Congress that outlines a plan for this, and you had some interesting proposals that really focused a lot on needing to drill down and starting to appeal to people on a more individual level, so that they're motivated to do the right thing. You had some interesting ideas about, for example, making sure we had hotels or other types of accommodations for helping people to self-isolate, maybe even having some monetary incentives there for isolation. Can you talk a little bit about whether you're seeing any of these ideas being picked up by communities and what it would take to implement them?
You're seeing them picked up at a state level. I mean, what I worry about in the fall is that we have very pervasive screening that's widely available to people, and particularly available in communities and at places of employment that are at greater risk of COVID. Not everyone is at equal risk of this infection. Not everyone faces the same risk of contracting this infection. There's certain communities that face more risk. There's certain people, because of where they work or how they get to work or where they live, that face more risk. And we need to make sure we get screening into those communities. And we need to make sure that we're screening not just for symptomatic disease, but also offering it to people who might be asymptomatic or even mildly symptomatic, and that getting COVID, having a diagnosis, doesn't become something that's punitive. It isn't something where you're forced to lose 2 weeks of wages, and maybe you're looked at negatively at a place of employment or in your community because you might have put other people at risk. If this is something that people perceive as punitive, having a COVID diagnosis in some way, people are going to be discouraged from getting tested. And we need to make sure that doesn't happen. And that's why we talked about in that letter that I sent with Dr. Wen was on it as well, but a number of public health leaders talked about things like trying to provide for lost wages, trying to even provide a stipend for people who agree to self-isolate, trying to make sure that people have a place to safely self-isolate. So if you can't self-isolate at home because you live in a crowded housing situation, you have other family members that you don't want to put at risk, that the state provides for a safe location. And that's where we talked about a hotel room, so you can self-isolate for the period of time in which you're contagious. I think that we need to try to put these measures in place and encourage people to get tested, encourage people to self-identify if they think they might have signs or symptoms of COVID.
Dr. Wen, would love your perspective as former, health commissioner in the city of Baltimore. How do we address what Dr. Gottlieb referred to, which is that we're beginning to see from the science that there are communities who are disproportionately affected by COVID-19? What do we understand about some of the biological reasons, as well as perhaps some of the social and cultural reasons for that?
Yeah, so I think there are two major points here about the communities that are disproportionately affected. One is the understanding that for many people, for all of us, social distancing is a privilege that not everyone has. There are essential workers who, until now, may not have been thought about as essential. We do think about essential workers as healthcare workers, as the doctors and nurses, but we're also talking about the grocery clerks, the cashiers, the bus drivers, the people who deliver our packages. These are individuals who, many of them are barely making a living wage, but have had to go to work during these times. And of course, they tend to come from communities that have disproportionate effects of COVID-19. Also, these are individuals who may live in crowded housing, as Dr. Gottlieb was saying, may not have the option of social distancing at home, may live in multi-generational housing where one person is an essential worker, and even if everybody else is sheltering in place, that person could still bring back the virus and infect everybody else too. So there's that element of how not everyone can choose to do social distancing. And then on top of that, we know that there are communities like Baltimore that already suffer from disproportionate effects that in medicine we call acute on chronic, that there are chronic underlying health disparities. In our city, there are communities just a few miles apart that have a 20-year difference in life expectancy. And of course, that difference in life expectancy, a neighborhood living where somebody born today can expect to live 65 years versus 85 years, these are also communities that face the disproportionate effect of other healthcare problems like high blood pressure, like chronic heart disease, like diabetes, which are then predisposing to having the severe impacts of COVID-19. So in essence, you have the double whammy. You've got the fact that people in communities like ours are the essential workers who can't socially distance, combined, as you were saying, Alice, with the fact that they already suffer from disproportionate effects of health disparities. And so I think COVID-19 has unmasked many of the structural inequities. We have to address this acutely by providing for testing, healthcare, isolation, exactly as Dr. Gottlieb outlined. But longer term, I hope that there will also be a light that's shown on these chronic underlying problems, these systemic racial inequities that have gotten us to where we are too.
And I think this is going to lay a really strong foundation for discussions about if and when we get a vaccine, for example. One of our previous guests on Time 100 Talks was Dr. Ngozi Okonjo-Iweala, who chairs the board for the Global Alliance for Vaccines and Immunizations. And she talked about how we need to think of the COVID-19 vaccine as a global good, as something that's available to anyone in the world who needs one. So if and when we do get a vaccine or vaccines, how do we ensure that they are distributed to everyone on an equitable level and on an equitable basis and to everyone who needs one? Dr. Gottlieb, your thoughts on that?
Well, look, I think first and foremost, we need more than one manufacturer to be successful here because there's no single manufacturer that's going to be able to supply perhaps the United States, let alone the entire world. So you're going to need multiple manufacturers to make it across the finish line here. I think the reality is that you're going to see nations supply the vaccine to themselves before they supply it globally. And this is just a historical fact. If you look back to 2009 with H1N1, there was efforts made by different countries, both the United States as well as other countries, to make sure that they had the vaccine available for their own populations before they made it available globally. We had vaccine that was destined for the United States in two friendly nations that was being manufactured in two nations that we maintained very good relations with. And they didn't make that vaccine available to us until they satisfied their local needs, even though that vaccine had been manufactured for the US. And we had a manufacturing facility here in the US that was manufacturing vaccine intended for the UK. And we didn't let it go so easily. So that you saw that kind of behavior. I would expect that we're going to see some of that this time around as well. Now, that said, the manufacturers that are developing vaccines are starting to manufacture at risk, not tens of millions of doses, but potentially hundreds of millions of doses. And so I think that there's going to be a lot of supply initially, but certainly not enough to fulfill global need. You might not need enough to fulfill a global need initially, because if there is a seasonal component to this virus, if we settle into more of a seasonal pattern, it's only going to be certain nations where you're going to be seeing outbreaks and potentially epidemics heading into the winter or into 2021, depending on when you think you're going to have a vaccine available. So you're probably going to make it available to the nations that are at highest risk of outbreaks at that time, after you probably satisfy your own local needs for the vaccine. In terms of when we're going to have it, I think, as I said, I think these manufacturers are going to be manufacturing tens and hundreds of millions of doses at risk. So we'll probably have vaccine supply available heading into the fall or winter of 2020. I think what we probably won't have is the card turned over on the big pivotal studies that we need to sort of demonstrate safety and efficacy in these settings. I think that we're more likely to have those trials underway probably in the fall. You're going to need a certain prevalence of infection in order to determine whether or not these vaccines are in fact working clinically. We're probably unlikely to have that level of infection in July, August, even September. I think that the most likely scenario is we sort of have a quiescent period of time in July and August. We see transmission break off to some degree, and it'll pick back up as we head into the fall and winter season. That there's going to be some level of seasonal component here in the United States and even around the world. And so you're probably not going to be able to enroll those big clinical trials and have enough people, where enough infections spreading in the background to be able to determine the safety and efficacy of these trials really until the fall.
Dr. Wen, I'm just curious about your thoughts. Dr. Gottlieb really pointed out the reality of our, current sort of manufacturing infrastructure. Is there a way to shift those priorities? We do have manufacturing at risk, which means that, there would be a greater incentive to produce these vaccines for the good rather than for profit. Is it time that we need to rethink pandemic vaccines and vaccines in response to emerging infectious diseases differently so that we've got a different infrastructure in place for that? And are we seeing that at all as we sort of get hit by wave after wave of these pandemic outbreaks in recent years?
I think we need to be rethinking our entire approach to emergency preparedness and response. I mean, we are now seeing the effects of decades of neglecting our public health infrastructure. You and I have talked about this in the past, Alice, of how public health has no face until something bad happens. And it's just not a popular topic to talk about prevention because you are preventing something bad from happening. You don't see the impact and the positive effects of that work until something bad actually occurs. And so we need to be looking at the investment that's needed in public health all across the board, local, state public health, as well as our CDC and other infrastructure. I think right now I am really concerned about complacency. I think it's possible, right, as Dr. Gottlieb was saying, that we're going to see potentially a decrease in infection over the summer. I think also as states are lifting their stay-at-home orders and reopening to various degrees. And I'm afraid that we're going to draw the wrong lessons from that. Reopening does not mean that the virus is gone. It does not mean that it's now safe to go out. And especially if we have a decline in cases due to the weather over the summer, I'm afraid that people are going to think, oh, we're through this problem. And not to worry, we have a vaccine on the horizon and treatments on the horizon. So let's not worry about this anymore. And then come the fall, we could have a resurgence that's even greater of COVID-19 combined with influenza in the winter. And we won't be ready once again. And I worry that we are not doing nearly enough to prepare, even in the short term, much less the long term, which of course I agree we need to be investing in that preparedness. But what about preparing our hospitals for a surge in the fall, winter? What about making sure that this time our healthcare workers do not run out of that personal protective equipment as we did last time? What about getting our testing, contact tracing to the right capacity that it needs to be? It's not now. How about let's work on getting it ready as much as we can during the summer and fall months for when this will come back in the fall. I just worry that the American people are not ready for that type of resurgence and potentially for having to re-implement shelter in place and other types of orders again. And last time, if we were not ready, we could say, hindsight is 2020. We could have known better, we didn't. This time we have no excuse.
Yeah, the kinds of things we wanted, it's an excellent point. The kinds of things we want to think about doing for the fall are different than the things that we're doing right now. And we need to start preparing for that. In 2009 with H1N1, we did see transmission. It was epidemic all the way into June. And if you look at the graph of that flu, it broke off in July and August and really collapsed and started to pick up at the end of August and into September. And you saw sort of the second wave of H1N1 and it picked up very quickly. This isn't an influenza strain, obviously, but there is going to be some seasonal effect here. And we could see transmission break off in the summer to come back very quickly as we enter the early fall. And we're going to want to make sure that those case-based interventions and screening is in place. One of the things I worry about is that it might be hard to get screened in a community. We're going to have very, very robust screening technology. The problem in the fall won't be on the back end. The problem right now is on the back end. We didn't have enough screening platforms in place. The problem in the fall won't be that we don't have enough screening platforms in place. We will. We're going to have more PCR-based screening. We're going to have a lot of point-of-care systems authorized on the market, antigen-based tests that could do point-of-care screening in the doctor's office. I think the bigger challenge in the fall is going to be on the front end. Where do you go to get screened? And I think there's going to be a lot of locations that can do screening and currently have systems installed for doing screening. The Abbott ID Now, the Sophia 2, all these point-of-care systems that have been authorized to do coronavirus screening that have a big installed base in doctors' offices and pharmacies that could be doing coronavirus screening. And if you call up your provider and you say, I feel like I have the flu, they're not going to say, come in and I'll test you. They'll say, let me give you the location of a site that does special COVID screening. And it's going to make it cumbersome to get screened. And so the opportunity to do very, routine, widespread screening in the community is going to be lost because a lot of locations aren't going to want to test for COVID because of the implications. Because if you turn over a positive COVID case in your doctor's office or in a pharmacy, it's going to mean you have to shut down for the day and do a deep cleaning and maybe quarantine your staff. And so people are going to be reluctant to do that testing at the point of care, point of where the consumer is. And so we could be thinking about how to get in place universal guidelines right now so that doctors can do testing in their offices without having to go through extraordinary steps if there is a positive case in the office. Those are the kinds of things I think we should be thinking about, how to push screening out into the community and not just relegate it to special sites. Because if we do that, if it's sort of drive-through screening at special sites, a lot of those communities that we talked about that already face obstacles getting access to testing are going to face even more obstacles getting access to testing. So that's something I would be preparing for that right now.
I think that's a really important point about looking forward. But Dr. Gottlieb, I also want to look back for just a quick second about, you mentioned the importance of the screening. And I think everyone agrees now that early on in the pandemic, the US was slower to implement testing and have wide-scale testing compared to other countries. And depending on who you speak to, some of the people lay the blame at the foot of the FDA as far as being the agency responsible for authorizing and allowing not just public health, but private sector companies and academic labs to be able to have the ability to create and conduct these tests. Do you think that criticism was fair?
Well, look, I've been consistent in this in terms of what I've said. I think we needed to get the commercial and the academic labs in the game much earlier. And so, at some point, and I don't know exactly when those phone calls got made and what the nature of those conversations were, but at some point in January and certainly in February, you needed to call up LabCorp and Quest and the big academic labs and start getting them spun up. It takes time to get those tests developed and validated inside those big labs. You need to allow at least a month, maybe 6 weeks for those labs to do that. You can't just flip on a switch overnight and have those tests online and have the capacity to run them at scale. And so those labs needed to be spun up because at the end of the day, I mean, a lot of the conversation has been around the CDC test, and the CDC had challenges rolling out that tests. That test would have rolled out to the public health labs. Those labs don't have tremendous capacity. To Dr. Wen's point, we haven't built out a tremendous public health lab infrastructure in this country. I think that's going to change. I think we're going to now see that as a strategic asset that we're going to make significant investments in. But even if the CDC test had rolled out perfectly and on time, and the public health labs have stood up that test earlier, that still wouldn't have been a lot of screening capacity. That might have been enough screening capacity to do a very limited sentinel surveillance program, but it certainly wouldn't have been enough screening capacity to deal with an epidemic of the proportion that we had. So you had to get the commercial labs in the game. You knew it was going to take time to do that. So you wanted to get them spun up as early as possible.
Okay, and in our final minutes, I just wanted to ask both of you, as we head into summer, it's going to be harder and harder, to stay at home and not want to go out and meet and interact with friends and family. What advice would you give people about the safest way to social distance? Should grandkids be allowed to see their grandparents, maybe see and not hug? What guidelines would you give to us to follow? Dr. Wen?
Yeah, so we are reopening. I think a lot of public health experts would argue that we are not ready to do so. We haven't seen the consistent decline in the number of cases that we should be. We have not met the White House's own criteria for reopening, including having the capabilities of testing, tracing, isolation. But regardless, we are reopening. And if that's the case, then in public health, we call the strategy harm reduction. That what we should do at this point is recognizing that everything that we do has risk. So how can we reduce that risk as much as possible? The virus hasn't changed, right? We don't have a vaccine. We don't have a cure. We know that the only thing that was keeping the virus at bay was reducing the transmission from person to person by physical distancing. And so any behavior that we do that involves people from different households interacting with each other necessarily has risk. But that said, I think there are things that we can do to reduce that risk. So here's my advice in general for policymakers. It would be to try to, as much as possible, follow the recommendations to reopen slowly and carefully, reopening those businesses that are essential first, to also be ready to have the stop signs, to have early warning signs and surveillance so that we know when we need to dial back and maybe reimpose some of these restrictions again. For businesses to do their part and as much as possible, continue telecommuting. If necessary, when bringing people back, follow the best guidance of the CDC and other entities and do things like staggered shifts and deep cleaning and keep people at physical distances, closing those common areas, not allowing many people to be packed into a conference room or closing communal dining areas. And then for individuals, recognizing too that there's such a thing as cumulative risk, that just because we now have to go back to work or just because we now can go to restaurants doesn't mean that we should. And so if we do have to work, that's not an open license to now schedule play dates and schedule dinner parties and big events again. We should still use an abundance of caution in our personal lives as much as possible. And so to your point, Alice, about what are the things that individuals can be doing, I think being outside is important. Getting exercise is important. Actually, being outdoors is a very safe thing to do. Compared to being in indoor crowded spaces, I would certainly recommend going outdoors, getting exercise, getting fresh air, trying to keep that physical distancing when possible. I would also recommend when people are getting together, for example, over Memorial Day or other holidays, that they can be together in people's backyards and see each other, but again, keep a physical distance of at least 6 feet. Bring a mask, wear a mask. If you're going to be within 6 feet of each other, do not share utensils. Don't have a communal plate. I mean, I think these are the simple steps that we should be taking, while also recognizing that Again, we should not be letting down our guard at this time. We've come so far. People have made so many sacrifices in getting us to where we are. Policymakers, businesses have to do their part, but we as individuals should continue to do ours too. And so keep up our guard and use common sense at the same time.
Dr. Gottlieb?
Look, I'll just say quickly, we're not going to be able to Dr. Wen's point, we're not going to be able to eliminate all the risk here. There's going to be some persistent risk. I think those are sound points. Things done outside are safer than things done indoors in close quarters. People just have to practice good hygiene. You have to engage with a circle of family and friends where you can have greater trust in the measures that they've been taking. And, just follow good common sense guidelines like we were doing for a period of time leading into this crisis. People were washing their hands more. They were cleaning shared surfaces. All of those things we should be mindful of and do. If everyone does those things on, a wide scale, that could have a really big, profound impact on the level of spread that we're going to see. I think my concern is that as transmission breaks off and we get into the summer, and we see the virus hopefully start to recede and we can get back to some semblance of normal lives, more of our normal lives, that we become a little bit complacent. We don't bring these practices back in the fall when we're going to be facing more risk, and we need to be doing that.
Thank you, Dr. Wen and Dr. Gottlieb, for sharing your experience and insights about how important it is that we navigate the coming months really in the right way to protect the world's public health. In just a moment, we'll join CNN host Van Jones, who will be speaking with Matt Damon and Gary White, co-founders of Water.org and Water Equity. Their conversation will be about the fight to protect and expand safe access to water and sanitation, both of which are really fundamental tools in the global response to COVID-19.
Estamos out there. Estamos on the front line helping to keep this country going. Estamos away from the ones we love who can't wait for us to come home. Estamos aquí. Estamos optimistic. Estamos resilient. Estamos hopeful. Estamos together. This is Estamos Unidos de América, a nation united by people who help each other and understand that those who put themselves out there need support. We don't win this alone. We win this together. PNG and Hispanic Star Estamos with you, providing relief for families in need and essential workers. Helping Hispanics, helping Estamos Unidos. Join us at hispanicstar.org.
Welcome back, everybody. I'm Van Jones. I'm so pleased to be joined today by Matt Damon and by Gary White. Both these guys are co-founders for Water.org and also Water Equity. Thanks for joining me. Look, it's a challenging time. Before we get into all the big stuff, how are you doing? How are your families?
Oh, well, it's a pleasure to be with you, Van. Big fan. And we're good. We've been really lucky. I'm actually in Ireland. I was here shooting a movie that got shut down a couple months ago, and we kind of had everything in place, so we just stayed, and it seemed like a great place to shelter in place. So we've been very lucky, and everybody's healthy and happy.
That's good to be. How about you, Gary?
Yeah, same here. We've been very fortunate in this, and as Water.org and Water Equity, we have staff around the world, and really pleased to say that we've been able to keep all the staff healthy to this point.
Well, I'm glad to hear that. This pandemic is a crisis that's really jumping on a bunch of other crises and making them all worse. You guys were recognized by Time magazine all the way back in 2011 for your work on the water crisis. Now, I'd like to I think people, they may have heard about it a little bit. Tell us a little bit about what Water.org has been up to dealing with that crisis before we talk about how COVID's making it worse.
I'll try to do this quickly. We basically, our system, basically what we do is we give, we facilitate microloans to some of the poorest people on earth so that they can get the water solution that is right for them. And it's been this incredible success story that's scaled a lot faster and better than we could have even hoped. And it's kind of like our pipe dream coming true. And in 2012, we reached our first million people, and we're about to hit 30 million people. So in less than a decade, we're scaling really quickly. And the good news is that this idea that the poorest and most vulnerable people on Earth will actually take control and take charge of their own solutions is something that we believed, and we've been proven right. So it's been a wonderful success story for us, and obviously COVID is kind of the latest wrinkle in this journey.
We're going to definitely talk about that, but I mean, 30 million, that's a huge number. I mean, you're talking about scale, you're talking about impact, you're talking about communities that don't have a lot of resources. Gary, what are you doing? What are your unique strategies? People are trying to figure out how to solve tough problems. What are your unique strategies giving you this ability to scale this strongly?
Yeah, no, I think Matt hit on it, and that is we recognized some time ago that the people living in poverty weren't necessarily a problem to be solved as much as they were a market to be served. And what we realized that people were already paying huge amounts of their income to get access to water and sanitation. They weren't able to work at paying jobs because they were waiting in line to get water from public stand posts or walking to distant water sources. And so we asked this what if question, what if we didn't have to have charity to reach everybody in the world, because there's never going to be enough charity? What if we could actually get people access to small loans so that they could get the water and sanitation solutions that they felt were best for them? And that has really taken off. As Matt mentioned, we're hitting about almost 30 million people now. And we've actually mobilized more than $2 billion in capital for these microloans that are repaid at a 99% rate, by the way, and 94% of them go to women. This solution has actually proven itself out, so much so that we've even been able to add a new element to the solution with water.org, kind of getting these markets ready and kind of working with local financial institutions to help poor people take affordable loans, while Water Equity, which is our sister organization that's a social investment impact fund manager, allows people to invest in these portfolios and get a return financially, but then they also are able to help us deliver huge social impact. So now we're actually beginning to merge the global capital markets with people living on sometimes less than $2 a day to get a loan.
And that actually, Water Equity was actually born out of a trip. Gary and I were in India about 5 years ago, and we were talking to these different partners of ours, these microfinance institutions, and we asked them what the biggest bottleneck was, to their work, and they said access to affordable capital. So it turned out the demand was incredibly large, but what was clogging everything up was the fact there just wasn't enough money in the system. So that's how Water Equity was born.
So you had to get the capital to flow to get the water to flow.
Exactly.
I think a lot of people don't understand how hands-on you are about stuff you care about, Matt. And, it's one of the things, for me, I find the most inspirational about you. Can you share any personal stories? I mean, just, you're such a massive star, but you're out there trying to solve these problems yourself. Any personal stories, anything that struck you, anything you've seen that really, moved your heart that you want the world to know about?
Oh man, I wouldn't know where to start. We take a lot of these trips and go out into the field as often as we can, and just meeting these, it's so inspirational meeting these people. As Gary said, it's 94% of our borrowers are women, and they're repaying at over 99%. And to think about that, and put that in context, these are people surviving on less than $2-3 a day, and it's kind of unfathomable to us in the West what that kind of poverty is, and to see it up close and to see these people taking charge of their own lives, it's just incredibly heroic. And so I have hundreds of stories for you. I think we've mentioned that the reason our borrowers are women primarily is because this issue affects disproportionately women and girls, because oftentimes that's who has to do the water collection. So girls are missing school. Millions of girls all over the world miss school or have to drop out of school because they're in charge of water collection. So you can imagine what that does to the outcome of their life. And so when you see water, delivered to a community, and you talk to these kids, and you realize that they're in school, and you talk to them about their hopes and dreams, and they have hopes and dreams. It's the difference between between having a life that and living out your potential, or just being relegated to this brutal cycle of poverty where you're just spending every day looking for water so that you can get to the next day. And there's not great hope in a life like that.
Yeah. Well, I mean, you stood up something now, two entities that are trying to bring hope. They're trying to solve real problems. And then here comes this pandemic. Here comes this plague. And I think, like you said, those of us who are in the West, I don't think we really think about how difficult it would be to fight this pandemic if you didn't have access to running water. Gary, can you just talk a little bit about the importance of water in stopping this global pandemic?
Yeah, I think, all we have to do is rewind to the early days of COVID-19. And what was the first thing we were told to do? Like, wash your hands a lot and vigorously. And it's like, okay, check that box, we can do that. But then you stop and think about, well, what if you don't have access to water? And I think that's just unfathomable for us. And it's unbelievable, actually, that over 700 million people don't have access to water, so they can't even take that basic first step. And so, we see water as a given for us to be able to fight disease. And then you also look at the fact that, if you do get sick, right, if you go seek out medical care and you go to one of these healthcare facilities in Kenya or, the Philippines or India, you recognize that more than 66% of healthcare facilities in low-income countries don't even have soap or running water. So imagine trying to be a frontline healthcare worker and trying to prevent the spreading of disease among people who are showing up to be treated, and you can't wash your hands between patients. And so for me, if there's some hope in this, it's a hope that, water will finally start to be recognized as the hero that it is in contributing to our health and our well-being. And hopefully what we can do is use this emergency response as a jumping off point so that we can build in more resilience to healthcare around the world and recognize that one of the first things that led to public health in this country was a stable supply of safe water and sanitation.
We were talking, Van, we were talking about all this personal protective equipment that, we've heard so much about in PPE and it's life or death, and it's incredibly important. And we know that. We were talking about it in terms of water. Like, water is PPE. Water's like the very first level. But here in the West, as you were talking about how it's hard for us to relate to water because it's ubiquitous for us. We can go to a tap in our kitchen, in our bathroom. Our toilet water is cleaner than the water that 2 billion people or almost 1 billion people on planet Earth have access to. So that first level of PPE, we wouldn't even think of that in the West, but it's water. And also, I would just also add that, we talk about social distancing, right? I mean, if you're using a community toilet, how do you social distance, right? It's so some of these things are really impossible in these densely packed areas without access to clean water and sanitation. You're really giving the disease all the advantages it needs.
Well, look, I mean, I had not thought about 95% of what you just said, and I consider myself to be a pretty conscious person. So I think you're educating people around the world about what is really needed. What are you guys doing differently now? How are you adapting and changing your strategy I guess you already ramped up from nothing to 30 million people. I mean, what are you trying to do now? How do you deal with this from your point of view?
Mm-hmm. Well, as you might expect, a lot of the work has had to slow down around the world for us right now. But there are like other pockets that are really opening up. A lot of this micro lending that does happen around the world has really scaled back. And yet we also see that as we work with local utilities around the world to help them get access to some of the poorest neighborhoods, we're actually seeing that increase in some areas. And so it is, even now, we're still trying to get our feet under ourselves in terms of how we continue to reach people directly. And that's starting to bounce back. But what we also see is this is a moment to take a step back and say, let's look at how we can help governments more to fulfill what is their mandate, really, and that is to provide water and sanitation services at an affordable rate to their populations. And what we see there, again, is sometimes a lack of finance. And so we're working with institutions, governments and we know they're strapped right now. We know governments around the world are strapped for cash, but trying to plant the seeds for, like, as we get past this, let's look in terms of how do we build disease resilience through safe water and sanitation and get the budgets established that need to happen. And you know, what's unique about us at water.org and water equity is that we come at this with the lens of the poor. And you know, infrastructure is built, infrastructure is invested in, but what we uniquely bring is making sure when those water systems get built, that the poor are at the front of the line and that they're not marginalized and just kept off the water grid. And so that's what we can do in terms of stimulating the infrastructure through finance, and then kind of, you know, holding people's accountable to make sure the poor get served.
You know, you say that like it's an easy thing. And I want to, you got to realize you got people who are listening. They're looking at you with their jaws hanging open. Hold on a second. You're dealing with some of the poorest people in the world, women, and getting them, you know, access to capital markets, infrastructure. Let's just take a step back. You're dealing with very low income, very low wealth populations all around the world. It is hard to get that right. What are some of the things that you learned as you've made your mistakes, and you tried to move forward, that you think other leaders should also learn? If we're going to start, if the pandemic is going to get us all through ripping through these impoverished populations, suddenly those impoverished populations, they've got to succeed, or the rest of us have no chance against this plague. That flips everything on its head. You guys did that yourselves voluntarily. What have you learned? What do you wish people would do more of or less of working with low income, impoverished, low wealth populations so we can all win this thing? I'll start with you, Gary.
Yeah, I'll jump on that. I think it's important to realize that in the last 2 decades, more than 2 billion people have lifted themselves out of extreme poverty. And this kind of goes back to what I said before. Let's think of the people living in poverty as more a market to be served. And I can just give you one example of that, right? So Matt and I were actually in the Philippines just a few months ago in the fall. And it was in the Philippines where I had met a woman. Her name was Lina Liza. And she was living in a slum near Manila. She was paying about $60 a month for a water tanker truck to come through and deliver water to her home. There was no access to piped water. She couldn't afford to then extend the network to her place and pay the connection fee, which was about $300, right? So what she was able to do with one of our partners is to take out a loan so she could pay that connection fee, get access to the utility. And now her loan payments are about $5 a month. And her water bill to the utility is about $5 a month. And so you can see, you know, going from $60 a month down to $10, there's a lot of capital in this system that's just being directed very inefficiently. But if you can't get over the hump of getting that loan and getting access to a loan, you're forced to pay $2 a day to make that water payment to the vendors. And that's what we're tapping into, the fact that there's this massive wall of capital that could be mobilized. If you multiply her by 2 billion people who need access to water and sanitation, you can see there's a massive wall of capital that's there willing to come from the bottom up. And what we've been able to do is tap that capital from the top down as well through social impact investors like the Skoll Foundation and the Hilton Foundation, and even folks like Bank of America, and can really create a financial infrastructure that allows that market to come together so some of the poorest people on the planet can get access to these services. And I think that's what we're trying to bring about.
I think there's one other thing I would add to that, Van, is a philosophical idea, which is that you have to trust and believe in these people and believe that they want to solve their own problems just as badly as you do, even more so, it turns out. And so I think that's one thing. Gary has just done that intuitively. And I think because he's been at this for over 3 decades, you know, having seen so many water projects fail, you know, half the water projects, you know, globally fail, right? Wow. Usually because they're delivered with this in this kind of paternalistic charity way where it's, here you are, here's your solution. And I mean, we've been I mean, a dozen years ago, Gary and I were in Ethiopia, and we looked at this beautiful well. It was a state-of-the-art well that an Indian NGO had raised money. You know, so they probably had some banquet in Mumbai and raised $10,000 and built this thing. And it was gathering dust because it was so high tech, and it had failed, and nobody in the village was taught how to run the thing. It was just put there. And so when it stopped working, they went back to a hand-dug well, the system they'd been using for hundreds of years, and this thing was just kind of wasted. And so it's like, I think Gary intuitively, and water.org, I'd say philosophically, we believe in empowering people to solve their own problems, and that really that's where the sweet spot is for us.
Oh yeah, I think it's really extraordinary because we think about poor people, low-income people, whatever you want to call it. You just point out something I never thought of before, is that there's a ton of capital there. It's just being wasted because, the systems don't work. But, when you say, listen, there's literally, an extra $55 lying around in the hands of a couple of billion people, you could marry that with the big capital and you could solve a bunch of problems. The other thing I think is great about what you just said is that you could do a big infrastructure project, and I'm sure a bunch of them are going to be proposed. But if you don't think about the last mile, the last inch of connectivity, the whole thing is a big waste. Yeah. So,
that's funny. That's literally, Van, that's exactly what Jim Kim, when he was running the World Bank, when we had this conversation with him, he said, I can get the 85% of the people. He's like, it's the last 15% that are the hardest to reach. It's like, he was making exactly that point.
Well, I think it's great. I think this virus is here to teach us about oneness and wellness. That's what I think. There's always a lesson in a plague if you read the great books and all the sacred texts or whatever. And I think this is about oneness and wellness. You guys have been trying to deliver on wellness from a point of view of oneness, really respecting other people. I wonder what I think about you, Matt. I mean, everybody knows your face. I mean, you can't walk on any continent. Probably the penguins know who you are. You go to Antarctica. Of all the things that you could be doing, what was it that got you doing this? Because you could literally do anything you wanted to. Any cause would be happy to have you. What made you decide to pick this cause?
As I started looking at all these issues of extreme poverty, I was really interested in getting involved, and nobody was talking about this. This is 15 years ago or so. And as I started to study and learn about it, I just realized that it undergirded everything. It undergirded all these other problems. And it was we're losing still 1 million kids a year completely unnecessarily. I mean, this is a problem we solved in the West 100 years ago, right? I mean, if one of my kids has a bout of diarrhea, that's not a life-threatening experience. It's like maybe they miss a day or two of school, and because they have access to clean water, which is all you need to stay hydrated, and you're going to get through it. But yet, if you don't, something as simple as that, right, can mean the end of a child's life, and it is for these completely ridiculous reasons. We're still losing people. I mean, imagine if we cured cancer, and in 100 years, the very poorest of the poor were still dying of this thing that we cured, right? It's unconscionable. And so I started to get really interested in it. And then, eventually I realized I had to get really serious. And I partnered I went for the greatest expert I could find in the water space. And when that person wouldn't take my calls, I found Gary, and we've been together ever since. Gary pioneered this idea of water credit, this idea that the municipality was already pumping water right under the feet of the poorest of the poor. They just couldn't get a water connection. And if we could front them the money, you would buy back all that time they were spending waiting in line and at a community tap that only came on once a week. And you would suddenly buy back their lives and allow them to go work and pay off that loan. And it was this idea that just was, it was just a perfectly simple and beautiful idea, and he was unbelievably right about it, and the rest is history. So we're marching on. We're hitting 30 million soon, and then it's onward from there. I mean, they have identified about 500 million people can be reached with this solution alone. So there's a chance to make a huge impact to any high net worth individual out there watching. If you want to make a real name for yourself, give us a call. We've got room for you at water.org.
Amen. The fact that Time Magazine recognized you guys, years ago, and that wasn't the peak of what you're doing. That was just the start of what you're doing, and now there's such a big, massive need. We got a question from somebody named Diana who just wants to know a very simple thing. Diana in Argentina, how can I help? We know if you're a gazillionaire, just call these guys up, give them a bunch of capital, they're going to put it to good use. What do you want ordinary, regular folks who may not be billionaires? Maybe Diana is a billionaire, but assuming Diana in Argentina is not a billionaire, what can folks do?
Yeah. Well, I think right now, we are focused on COVID-19, and that's appropriate. And there's a lot of immediate steps that people are taking and providing, support for relief efforts. I think as people get beyond this and look at a different dimension of it, and that is the resilience, give support to resilience and see water and sanitation as resilience. And of course, at water.org, we're putting, everyone's dollars to great use to that end. And I think what we also need to look at is beyond that. You talk about the oneness that we all have as well. And as long as one of us around the planet isn't healthy and doesn't have access, then none of us are going to be healthy. And I think COVID-19 has driven that home, that we are one. And a disease that emerges, in a slum in some place halfway around the world, next month can be in your neighborhood. And I think that's why it's important for us to look at resilience across the human family. If it's not a moral imperative to do that, to help those people, it certainly is enlightened self-interest on our part to make sure that we help the whole world stay free of things like COVID-19.
Last question. 10 years from now, God willing, we're going to be past this pandemic. Hopefully we'll have learned a ton. Hopefully we will have come more together. But there's still going to be challenges out there. 10 years from now, what do you hope that water.org and water equity will have accomplished and will be doing before we close? Give me your 10-year moonshot here.
I hope we're out of business. That's my moonshot, man. I hope we get put out of business because it's no longer an issue. And listen, it's that sounds like a crazy moonshot, but so did the moonshot. And we do see a pathway to that with the proper engagement. This is a problem that is solvable. This is completely solvable. It just takes global engagement, and it's about the will to do it. I can tell you the women that these women who they're heroic. They're the poorest women in the world, and they're paying back loans to buy themselves out of this problem, to solve their own problem for themselves and for their families. I mean, it is a remarkable story, and hopefully one that we're going to tell about 800 million more times, and then we'll be through with it.
Wow.
And it is going to be a heavy lift, but we can get it done because we'll do it in partnership. I mean, the Sustainable Development Goals, number 6 is water and sanitation, and the world is aligning behind it. And I just want to make sure, this isn't just us, right? We have kind of sparked some new ideas and some new thinking, and some hypotheses have borne out, but we're collaborating with everybody to make sure that we can reach that goal so that we're all out of business in 10 years, when hopefully we'll have reached all the Sustainable Development Goals and put things like this behind us.
Well, listen, it's just an honor to talk to you. It's so inspiring. You got a lot of do-gooders like myself, and we go up against these impossible odds. And when somebody has a brilliant idea, simple idea, and they execute it well, and they got the numbers to show for it, and they got the vision going forward, you deserve to be Time 100 forever. Thank you so much for what you're doing. I hope anybody listening reaches out and gives a hand here. Water is PPE, period. Full stop, drop the mic. Anyway, thank you so much. Now, I gotta go to the next person. I wanna introduce the award-winning journalist, Katie Couric. She's gonna be speaking with the Iceland Prime Minister, Katrín Jakobsdóttir, who has been an incredible leader throughout this whole period. Katie, I give it over to you.
Hello, everyone. I'm very pleased to be joined today by Prime Minister of Iceland, Katrín Jakobsdóttir. I hope I pronounced it correctly. Madam Prime Minister, thank you so much for being with us.
Thank you. And it was pretty close, the pronunciation.
Why don't you tell us actually what your last name means and how you would pronounce it?
Well, my last name is Jakobsdóttir, and it means daughter of Jakob, because in Iceland we have the tradition we are named after our fathers, sometimes our mothers though, too.
Well, thank you I tried my best. Hopefully I'll get it when we say.
It was good.
Thank you. So I'd love to talk to you about the strategy that you all have followed during this pandemic. Where I live in New York, we're entering our third month of shutdown. Schools are closed. Restaurants are takeout only for the most part. It's not clear when many of us will be back in the office. So how would you describe Iceland these days? What is life like there?
Well, we are gradually lifting restrictions. We have been now down to 0 infections several days in a row. There have only been three new infections, I think, this month in May. So, and we have been down to 0 now for several days, but that's something that we are just continuing to follow very closely. We still have people in quarantine, but we are lifting the restrictions. People are attending work, but we are still maintaining that we are doing a lot of tests. We are still tracing all new infections, even though there are not many of them. We are still using quarantine. So we are maintaining some social distancing.
So it's been obviously positive, but what strategies did you employ at the very onset of the pandemic that really helped you keep it under control and keep the spread at bay to a certain extent?
Well, we started our preparations quite early, actually. But it has been a work in progress, really. We have been learning as we go by. And we began by testing, and then we actually increased the testing a lot. We did that by actually entering into a collaboration. So the public health services were doing a lot of tests, but we also had a private company in health sciences doing a lot of tests. The tests were free for all people living here, so people could have a test without having, they didn't have to pay for it. So we have actually done well over 50,000 tests here in Iceland. There are only 350,000 people living here, between 350 and 360. And then when people were actually infected, everybody they had met were put into quarantine. First, we did that by just really asking them who they had met, and then we used the old-fashioned style of just using the telephone, calling everybody, say you met an infected person, you have to go into quarantine. And then actually we designed a tracing app, which we have encouraged people to use, so it's easier to trace really where they have been. And obviously we also implemented the rules of social distancing. In Iceland, actually, we never closed down primary schools or kindergartens. We kept them running just with limits, if you could say that. So actually they had fewer students at the time. So there were limited services, but they stayed open.
When you say limited services, what do you mean exactly in schools?
Well, for example, my sons went to school for 2 hours a day instead of being the whole day, really. So they actually could continue their studies by using technologies, learning more at home, but always met their teacher every day, really.
And then, so when they met their teacher, not all the students were there at the same time. They were in shifts.
Yeah, there was a 20-person limit, and you only could meet people from your own class. So we have actually used the social distancing method a lot.
In the US, we've seen a lot of resistance, people not complying with orders, etc., getting quite angry about it, protesting. Did you see anything like that in Iceland?
No, I think actually you could say there was an overwhelming support for these actions that were taken. And I mentioned the large amount of testing that we have been doing. Actually, I got the latest data here. More than 57,000 people have been tested. And actually, people decided that they wanted to get tested. They stayed in quarantine. We have had maybe a few bars that tried to open up before they should have, or something like that. All relatively, I would say relatively very few incidents. Some people tried to sneak into a closed swimming pool before the swimming pools were opened. But Iceland is, of course, we're a small country. What we sensed during this pandemic here in Iceland was that there was a great solidarity. And maybe because we are an army, we don't have a military in Iceland. We are really focused on that we are a very liberal society. So actually you could say that the responsibility was placed on the shoulders of each and every one of us. And the slogan was that we are all really part of this public security. We all need to be a part of it if it's supposed to work. And I think that has actually worked.
You mentioned that Iceland has a population of between 350 and 360,000 people. Do you think that the strategy that you implemented would work in a country like the United States or the UK with populations of 330 million and 67 million respectively? Why has it been so challenging, do you believe, in those countries?
Obviously, I think the size of Iceland has been a benefit for us. For example, when you're trying to trace who you have met after you get infection or are suspected of having an infection. In Iceland, we know really, we all know each other. So the tracing becomes relatively much easier in a smaller society, for example. It also, when being a small country, I think people really experience this feeling that we are in this together, that we are fighting the epidemic together. I also think that the strength of Iceland in this progress has been the public health system and the fact that it's accessible to everyone. The public health system is accessible to everyone. So I think that's a very important factor.
What would you say, obviously, after listening to this, everyone's going to want to move to Iceland, but what would you say was the biggest challenge? Because at times, I'm sure there were challenges as you faced this pandemic. What were they?
Well, first, obviously, we are not perfect. And I think when we will look back, we will have a lot to learn from this process, really, because we, like everybody else, have been learning really as we go by, because there are still a lot of things we don't know about this virus. And the challenge is always, in January, even though we had heard about some new flu coming up in China, nobody really expected that this would happen. So the challenge has really been to keep everybody on board. That was done really. One of the decisions, I think the right decisions that we made was that we have had a daily press conference where the chief epidemiologist, the medical director of Iceland, and a representative from the public security services of the police, they have been there answering questions, all sorts of questions from the media, trying to give as much information as possible to the public. And I think that has been a challenge, to keep everybody informed, because a lot of information is traveling through the internet. And this was really one of the good decisions that we made. Let the scientists really be there, and they were really ready to do this, which was amazing, to answer all the questions and be in a daily contact with the public.
You're right, though, the virus has changed so much, and they're learning in real time so much about how this works, how it spreads, the different symptoms. And so I'm sure it was challenging for them, but at the same time, it sounds as if you gave scientists the lead on this in terms of communicating with the public. You put them front and center. Is that right?
Yeah, we did that. And they also approached the project very humbly and said, we really don't know everything, and we are not going to be able to answer all your questions, but we will try our best. And I think that is something that the Icelandic public really appreciated, that these were just people trying to do their very best in their job, which was complicated.
I'm curious because I think misinformation and conspiracy theories are running rampant during this period. That obviously worked well to tamp down people believing some of the things that they were reading that were inaccurate. But did you see this misinformation manifest itself in any kinds of behavior or attitudes in Iceland itself?
I can't say I did. We are actually planning to try to see, trying to really map out if there was a spread of misinformation, but I can't say that I have experienced a lot of misinformation during the epidemic. It has really been more like a learning process where people have been trying to get a clearer picture every day and see what works and what doesn't work, really.
You are one of a number of world leaders, the Prime Minister of New Zealand, Angela Merkel, the President of Taiwan, and you all have been credited with really managing this crisis very effectively. It happens to be that you are all women. Is that a coincidence?
Well, I don't think it is a coincidence, but we have also examples of male leaders managing the epidemic quite efficiently. I think what we are seeing here and what we can learn from this is that it's important to put your ego as a politician aside and learn really from those humble scientists that have been really faced with this crisis that nobody really could expect. Be ready to admit that we are all really learning by doing, and probably we will make mistakes. And I think that has been maybe the biggest issue of leadership, and maybe that comes easier to women than men.
I was going to ask you if there's some unique qualities that women bring to the way they approach leadership, and in this case, running the pandemic. But you would say humility is perhaps one of the key factors in their success?
Yes, and also and I think the science and research has shown its importance very clearly during this epidemic. And I think that hopefully we can also learn to apply that and towards other challenges, like climate change, for example, that we put science first there.
Well, that's interesting because I know before you became Prime Minister, you were an environmental activist, and it has been extraordinary to see the transformation of the environment during this period of time, whether you're talking about fish swimming in the Venice canals or the air clearing in some of India's most polluted cities. Do you think that people will be inspired by this and that there will be a shift in the conversation about climate change in the wake of this pandemic?
Well, I think I consider it an opportunity to really revive the discussion on climate change, because climate change is right where we left it really in February. The challenge hasn't gone away. And now we really need to think how we are going to tackle that. I'm also worried that after this crisis, climate won't be a top priority for everybody. I think it's never been more important than climate continues to be a top priority for governments around the world, and we might use some of the lessons learned from this pandemic to help us in that fight against the climate crisis.
You're worried. How do you keep it on the front burner? How do you keep it a real focal point of conversation?
Mm-hmm, absolutely, because obviously we are right now in this epidemic and it takes all our attention. However, the Icelandic government is continuing with our plans of fulfilling the Paris Agreement and becoming carbon neutral no later than 2040. And we will just continue in that in our action plan to get those goals.
Before we go, I just wanted to ask you about tourism. Obviously, it's a critical part of Iceland's economy. You want to attract tourists. So my question is two parts. You plan to reopen to tourists by June 15th. What safety measures are you going to be taking as people come back to the country? And how is your government supporting workers and businesses as they challenge this economic time, particularly those in the tourism industry?
Yeah, tourism is, this is a really important part of our economy. More than 35% of our export revenue in 2019 came from tourism. So it's a very big blow for Iceland economically. So obviously, we are thinking about what we can do to support the economy by doing other things than tourism, by investing more in innovation, research, and other sectors. But we think Iceland will continue to be a good place to visit and that the tourism will revive. Now we are actually working on a plan that hopefully we can open our borders in the middle of June. However, we are still making our economic analysis of that and also our analysis of the health sector because we need to be prepared. And what we are planning to do is offer that everybody who comes here actually can get a COVID test when they enter the country. So that's really our plan, so we can actually lift our border restrictions.
And how have you been supporting workers, not only in tourism really, but all kinds of workers whose financial states have been so adversely affected by this pandemic?
Well, we have obviously our system of unemployment benefits, but what we did was that we offered really the companies to have workers partly on unemployment benefits and partly in work. And I think over 35,000 people actually have been using this part-time work method that we are paying. The government is really paying the benefits. And then we have been supporting the companies with different sets of measures. We have also been increasing our social budget to support people because this is something that really affects everybody in society. And we have been seeing more indications of more gender-based violence, for example, domestic violence when people have been more at home. So we need to really think about and ensure that the social fabric of society is working. And that's been also one of our emphasis. And then we're thinking ahead, making more investments, like I mentioned, in different sectors to strengthen our economy for in longer terms.
On a personal note, as we close, what is the most important lesson that you've learned just as a human being going through this process?
I think the most important lesson, I keep reminding myself that on the last day of the year, the Prime Minister of Iceland always gives a speech, and there I was talking about what would happen in 2020. And 2020 has been very different from what I expected. And I think the most important lesson is you never really can tell what challenge you will meet, and you always have to be ready to learn everything again when you get a different challenge like this. You have to learn everything you thought you knew.
And that, again, requires humility.
Yes, and it also requires that you're ready to take on that task, to really revise all your ideas and do things differently.
Well, Prime Minister Katrín Jakobsdóttir, hold on. Prime Minister Katrín Jakobsdóttir?
Yes.
Thank you so much. We really appreciate your time, and good luck as you continue your important work. Thank you.
Thank you so much. It was a pleasure. Thank you.
Thank you, Katie, and thank you, Prime Minister Jakobsdóttir, for your time and your insights. I hope I got that pronunciation okay as well. Clearly, there's a lot the rest of the world can learn from Iceland and the ways that it has confronted this crisis. Next, we'll be joined by my colleague, Haley Sweetland Edwards, Senior Editor at Time. Haley will speak with Ai-jen Poo, Executive Director of the National Domestic Workers Alliance, and Monica Ramirez, founder of Justice for Migrant Women, for a conversation about the challenges that workers, particularly domestic workers and farm workers, face during this crisis.
Hi, everyone. I'm Haley Sweetland Edwards, and I'm pleased to be joined by Ai-jen Poo, Executive Director of the National Domestic Workers Alliance, and Monica Ramirez, Founder and President of the Justice for Migrant Women. Thank you both for being here with us today.
Thanks for having us.
It's so great to have you here. And Ai-jen, I just want to jump right into it. In April, you wrote in Time that the care workforce, made up of professions like teachers and nurses and hotel and domestic workers, is in deep crisis. Can you just take a minute and explain to our viewers what that crisis looks like?
Absolutely. There's kind of two dimensions of it. One is that the workers that we count on, for example, home care workers to take care of our aging loved ones, they, before the crisis, worked very long and unpredictable hours without access to a safety net or paid time off or sick days or health care, and very little in terms of wages. And so there wasn't a lot of money to stock up on groceries or supplies. And so when the financial impact of the crisis started to take hold, very early on, we were hearing that people were losing clients, losing income, and faced with an impossible choice around how they were going to feed their families and keep their loved ones safe. And so just this, we had meetings where workers would gather and they would show us, literally, there would be 1 cent left in their bank account, or talking about the next week, they weren't sure how they were going to afford to buy milk for their children. At the same time, we had home care workers who are continuing to work through the crisis because in many cases, they are the only lifeline to the people that they care for. And some of the people they care for are some of the most vulnerable to the virus itself. Older people, people with chronic illnesses, people with disabilities, and we need them to continue to work, but they didn't have protective equipment, they didn't have access to testing or care, and so it was also another set of impossible choices around knowing that you are an essential part of the workforce that will get us through this crisis, but not having any of the resources to keep yourself and the loved ones, your own loved ones and the people that you care for, safe. So it's just been a really devastating and challenging time for our workforce.
Is there someone in particular you're thinking of whose story you can sort of briefly explain to us who illustrates this crisis for you?
Sure. The first person who comes to mind is Maggie, who is a caregiver in Chicago, and she had multiple clients, and most of those clients canceled and laid her off, but she has one who she continues to support through the crisis, a 94-year-old older person, but she also has a 12-year-old son who's home from school because schools are closed. And so she needs to figure out how she continues to bring food and medication and support the older woman that she cares for. And she has to bring her son to work with her. And she has to figure out how she's going to get to work, minimizing all of their exposure to the virus, and at the same time barely earns enough to make ends meet and has started to accumulate thousands of dollars in debt just to pay for food. So that's the kind of reality. And when we think even about something as simple as transportation to get to work, we're hearing stories of domestic workers who are taking the bus 3, 4, 5 hours just to get to one client, right? It's just such a challenging environment for the workers who we know are essential right now.
Right, absolutely. Monica, so many of these women that Ai-jen is talking about are women of color. Many of them are immigrants. And at Justice for Migrant Women, much of the work you do in advocacy is in behalf of these communities in particular. What do you want to see on a policy level, on a social level, that really begins to address and will have an impact on some of the workers that Ai-jen is talking about?
Yeah, thanks, Haley. And thank you, Ai-jen, for everything, as always. So much of what Ai-jen has explained about what's being experienced by domestic workers and caregivers is the experience that many low-paid women workers are experiencing, including other immigrant women workers. And, for us, at Justice for Migrant Women, along with National Domestic Workers Alliance and other organizations, our fight has been a fight for recognition under the basic labor and employment laws of our country for many, many years and before this crisis started. And so, we continue to push to ensure that our communities are not left behind, that as the relief bills have been discussed and passed, that our communities be contemplated and covered. It's not enough to say that the workforces that immigrant women and women of color are working in, which are the most important workforces that we've seen, continuing to labor despite the virus, do so without any protections. And unfortunately, our political leaders have not stepped up in the way that they need to ensure that these workers are being cared for and covered as these bills have been passed. And at a societal level, we've heard over and over again from people about domestic workers, caregivers, farm workers, grocery store clerks, and the list goes on, healthcare workers being heroes. But the question that we have is that when this moment passes, will these workers continue to be viewed as heroes? And what will our country, everyday people, and political leaders do to actually show that they value the work and the lives of these workers enough to actually make the changes that are required at a political level and at a policy level?
Absolutely. I mean, as you point to put just a finer point on that, there's this disconnect between this narrative about heroes and what our society is actually doing to support these people, many of whom are women and immigrants. What happens to the women, many farm workers and low-wage workers who are not receiving, stimulus checks? Maybe they're not citizens, maybe they're not documented. What does their life look like right now without the support, any support really from the federal government?
People are relying on community and each other, and it's frankly not enough. No matter how, the National Domestic Workers Alliance has launched an emergency relief fund called the Coronavirus Care Fund to provide $400 in emergency assistance to caregivers and domestic workers in need right now. And it's a wonderful thing. In fact, we've had more than 105,000 caring individuals contribute to this fund, and it's incredibly inspiring. And yet it can never replace what the government must do to provide a strong safety net for all of us. I think what this crisis has really revealed is just how unsafe our safety net is. And if it's also revealed how many workers that we've kind of taken for granted and made invisible in our economy, how many of them are actually essential. We have a moment to actually take a step back and say, how do we value all these workers? How can we protect them? And how do we make sure that our safety net actually keeps us safe? And I think that it is about all of the caring individuals that we know are out there in this country coming together and saying, we need action on the part of our elected leaders to make us all safe.
Mm-hmm. Yeah, I agree with that. Most of the work that we have been doing over the last couple of months has been focused specifically on the farm worker community. There are 2.5 million farm workers in our nation, and what we've been hearing from workers across the country is a feeling of instability across the board. So the economic instability, insecurity around whether they will become ill because they don't have the protective gear, fear that they're going to get their own family members sick because they don't have the protective gear and they continue to go to work. And then also we've heard a lot of people talking to us about the stress and the trauma of living through this moment without having the security that they need. And this irony of being called essential workers, yet being left completely behind in these bills. And so, just as much as we believe that it is necessary for us to figure out how to provide funds and resources to get the workers the food and support that they need, we also need to figure out, what are we doing as a society to make sure that there isn't the disconnect between saying people are important and then not treating them as though they're important. And that also requires providing support around their mental health and the ability to have self-care in this moment of crisis, which unfortunately we're not seeing happen. And so we're hopeful that as we think as a society about what it looks like going forward, that we're not just thinking about how to meet people's basic needs with food and shelter, but how are we also helping to support their emotional and spiritual needs beyond this moment.
Before we telescope out to sort of the problems in the larger society, Monica, can you tell us a little bit about hashtag masks for farm workers and the Farm Workers COVID-19 Pandemic Fund?
Yeah, so the Masks for Farm Workers project was a project that was the vision of fashion designer Mario Della Torre. He really wanted to make sure that farm workers had masks, as they continue to go to work. He was actually making masks for a children's hospital at the time when he decided to create the project. And he approached Hispanic Heritage Foundation, one of our partners, and told them the idea. They then contacted us at Justice for Migrant Women, and we brought in the National Center for Farm Worker Health. And the project aims to provide farm workers across the nation with masks so that they have PPE, which they're not currently being provided by most employers. But the other thing that happened as we were building the project is that we found out that of the 174 migrant health clinics across our nation, half of them are facing site closures because they don't have enough PPE and they don't have enough money to stay open. So essentially, farm workers are being put out on the front line to continue to do the work at great risk of getting harm, and their healthcare providers might not be there to help them when they get sick. So the project's been expanded to provide masks to farm workers and rural healthcare providers, and we've been able to provide thousands of masks at this point to clinics and to farm workers around the country. And thanks to the generous support of a number of different entities that make masks, we're going to be able to multiply the number of masks in the month of June, which is our peak agricultural season across our nation. So we expect to be able to deliver up to 500,000 masks in June. Which is really critical because between June and August, that's when most farm workers will be on the move and living in labor camps. The Farm Worker Pandemic Relief Fund that we created is specifically to meet the basic needs of farm workers. So farm workers were reporting that they did not have enough food to eat, at first because of hoarding, and then later because they didn't have enough money to buy the food, and they often were working when the food banks were open, so they were not able to get food from the food banks. So the fund provides resources to organizations that are farm worker serving organizations that help meet emergency needs of farm worker community members across the country. And it also is providing for emergency cash assistance, diapers, formula, and other things that farm workers need in this moment. And so we've given out about $1 million from the fund over the summer months, which we believe will be the peak crisis for the farm worker community as more people are living in labor camps. We'll do another round of funding. And then in the fall, which will be the recovery phase, we intend to do a third round of funding to organizations in the US and in Puerto Rico.
Great. And Ijen, pivoting back to you, both you and Monica have already alluded to addressing these immediate problems, getting masks and supporting these families during this time of immediate economic crisis. But both of you have alluded to the fact that this is a larger systemic societal problem. Many of these workers that you are advocating on behalf of were teetering on the edge of insecurity before this hit. Ijen, what would you say that these relief efforts need to do to sort of change the long-term structural problems, not just the immediate symptoms?
I think it begins with really understanding that there's so many people working in our economy, especially in the low-wage service economy that has been so devastated in this crisis, that did not have any real economic security or access to a safety net. And so I think it begins with initiatives like the Essential Workers Bill of Rights that Senator Warren and Representative Khanna have championed to really provide protective equipment, access to testing and care, child-independent care for essential workers, rights for essential workers who demand PPE so that they don't get fired for demanding and asserting their rights. There's a whole suite of basic protections that we can begin providing essential workers, but ultimately we should provide every worker in this economy. I mean, I think if we're now awakening to just how many workers are essential, it should beg the question, is every worker valuable and deserving of access to a safety net in this moment? So I do think the opportunity here is one of generations to actually establish a safety net for the 21st century that secures the American workforce, puts us on a path to recovery, and also puts us on a path to a kind of economy that allows for every worker to have dignity and to have protection. And so essential workers' rights to begin, but really, how do we create the safety net for the future that secures work in this country? And that will keep us resilient, I think, for the long term.
Mm-hmm. Is there a silver lining there, maybe, that this crisis has put a very sharp focus on all of the work that so many of these people do? I mean, we have selected some to be labeled essential, where they can continue to go to work. But I think that in the last couple months, people have thought, thank goodness there are people out there in the fields. Thank goodness there are people in the meatpacking plants, or else, the life would not be able to go on as we have known it. Are you seeing any of that appreciation crop up, or am I being a little too Pollyanna?
Well, first of all, we take issue with the terminology around essential workers because not all of the workers who are essential workers were defined as such. And so we think it's important for people to just understand that all work and all workers are important and critical. And so we want people to not use that language to differentiate between what workers deserve rights and protections and which workers don't. But I do think that this moment has put a spotlight on many of the workforces that have been less visible, and because they have been less visible, have also been denied a lot of the benefits and protections that we've been talking about today. We started the Phenomenal Farm Worker Project before the pandemic really started to have its effects across the country, and so it's been giving us a lot of heart to see more people using the hashtag Phenomenal Farm Worker as they talk about farm workers, and they talk about farm workers being the heart of the food supply chain, and that is the case for other workers in other industries too. So that makes us feel like there has been a breakthrough in terms of finally showcasing and lifting up the important work that some of the low-paid workers across our country have always done. And now we're looking forward to the opportunity to continuing to build with people so that we can make sure that all of these workers have the rights and benefits that they need.
And if I could just add to that, I think as somebody who works with care workers and caregivers, the fact that care workers are seen as part of the essential workforce, and the fact that so many families right now are kind of staring the reality of caregiving in the face, both with children home from school and parents who've been taken out of nursing homes, and just so much caregiving and so much of life being centered around the home. I think there's also a new appreciation for the value of care in our lives. Just how challenging and how much work caregiving really is. And so I think that there's silver linings on many fronts here if we take this awakening and really turn it into lasting change at the policy level and in our culture, so that it extends far beyond this crisis and it makes us better as a society. I keep thinking, wouldn't it be an amazing thing if we look back on this moment and we talk about it and reflect on it with our children and our grandchildren, to say that this is the time when we as a country went through a horrendous crisis, but it taught us how to take care of each other and how to value each other in a different way.
Absolutely. And crises are the times when we get to reinvent ourselves. And that's true for societies as well. We just have a few more minutes, and I wanted to end with a question from our audience. We have Bohannon, and I'm not sure if I'm saying your name right. I'm sorry if it's wrong, in the US. What do you see as the long-term social impacts of the pandemic? And that is that goes off what we were just talking about. Let's begin with you, Monica.
Well, the long-term social impact, I believe, from this pandemic is that it has allowed us to see the numerous inequities that exist, and it has given us a chance to figure out how we're going to address those. So it is not by chance that women of color and people of color in our country are becoming sick from COVID at higher rates. It's also not by chance that many of these workers who are in these low-paid jobs continue to go to work without the protection that they need. And the list of inequities goes on. And we now have a chance to say, how are we going to fix it forever? And who are we going to be building with, and how are we going to create this world of our dreams, which, iGen, myself, and many other organizers around the country have been working to create for a long time. But now there's a path that has been cleared to actually allow us to do the work, and hopefully an expedited manner, now with the help of thousands of people across the country and around the globe.
And iGen?
Oh, I would just add that I think that's absolutely right, Monica. And I would just add that it allowed us to culturally understand just how interdependent and interconnected we are, and helped us design solutions that leave no one behind. Whether it's a safety net for workers or a caregiving system that helps us really take care of our families, that this is kind of a new approach to our systems and our culture that leave no one behind and keep us all safe together.
All right, so for our very last minute here, just very quickly, maybe in the extent of a tweet, if each of you can tell our viewers what they can do to help, what the average person sitting in their home during this time of crisis, what they can do to help the workers that we've been discussing for the last 20 minutes. iGen, let's begin with you.
I would say that now is a critical time to call your member of Congress and even tweet at them, because they're definitely watching their Twitter feeds, that you support essential workers and an inclusive relief and recovery program that leaves no one behind.
Beautiful. Monica?
Great. And I would say that we want everyone at home to continue to celebrate the work of all workers, to continue to question why workers are not being protected by the laws, and to help organize in their communities so that we can get the protection that workers need at the state level as well as at the federal level.
Thank you, iGen and Monica, for joining me today and for this important discussion on how we can better protect workers going forward. Next, I'd like to introduce Time's executive editor, Dan Maxey, who is joined by Ben Platt. We heard Ben's amazing song, So Will I, earlier in the event.
Thank you so much, Haley. I'm thrilled to welcome back singer, songwriter, and actor Ben Platt. Ben, thank you so much for being with us, and thank you for giving me an excuse to wear real clothes today. I really appreciate it.
My pleasure. Same here. Same here. It's my first collared shirt in a long time.
Oh, yeah. So let's start with a basic but important question. Where are you right now?
I am in my childhood home in Los Angeles, where I grew up, living with my parents and my little brother right now. And usually I'm in New York, but circumstances extenuating, here I am.
So how is it going being with your family for the first time in, I can imagine, many years?
It's been really good. I mean, it's, a horribly unfortunate situation we're all in, but the one silver lining has really been this extra time to spend as a family. I'm usually the only fledgling out on the East Coast, other than my little brother who goes to Penn for school. So I never really envisioned that I'd be spending multiple months home with everyone. So it's been a nice silver byproduct to get to spend extra time with the family. It's been really good. Been reverting a little bit to my teenage self, but otherwise good.
I would be doing the same thing, believe me. So obviously we heard your song, So Will I, at the beginning of the show. Is it true that you wrote and recorded the whole thing during self-isolation?
Yes, it is. I at the very beginning of quarantine, I knew I wanted to write something about what was going on, and I was a bit skeptical about Zoom writing over Zoom, like a FaceTime session, and but then I had the idea for the song, and I loved it too much not to try. So I Zoomed with Michael Pollack, who's one of my most frequent collaborators, and the two of us really clicked over Zoom. Thankfully, we had a lot of pre-existing dynamic and relationship, and we wrote the song over the course of a couple hours. And then I sent it over to Phineas digitally, and he produced from within his own home and played all the instruments himself. And within about a week, we had the full song.
So how did that process work? Were you like listening to music like over Zoom and then singing back and forth? Were there multiple people on it? Like I imagine that was probably a really interesting challenge to have to deal with.
It was a really new kind of dystopian experience at the beginning.
Yeah.
But it was just Michael and I sort of came to him, much like we are on Zoom together now, and said, this is the idea for the song. This is the concept. I would love it to be someone posing all of these what ifs and fears, and then the singer is comforting them with each sort of answer and constant. And then Michael was at his piano and he would start playing some chords, and I would try to hear through my earphones and be like, those sound nice, or that sounds nice. And we would just kind of go back and forth and try melodies. And eventually 2 or 3 hours in, we had kind of a structure of a song. And then once the song itself was written, Phineas really did the production very much on his own. And he's incredibly talented in the sense that he really was able to just kind of thrive solo.
That's great. And I know you recently gave an interview where you talked about how you wanted to write this song and you thought it could really speak to this moment. Can you talk a little bit about what you meant by that?
Sure. I definitely wanted to write something that could resonate right now, but that had the ability to sort of live on, because as we all know and hope, this is a very temporary situation. And I think the song is a lot about when things get a little overwhelming, or when there's too much fear, or you're feeling kind of weighed down by the heaviness of the world, which I know I was feeling, and I'm sure everybody is feeling right now, that there are things that are constant, and there are things that will always be there for you, whether they be, as simple as the ground and the sky and the sun, or obviously eventually the message of the song is like the other people in your life will always be there for you, and there are people who are looking out for you and who love you. And yeah.
I love that. That's a beautiful message for these times. And obviously, you are a big believer in the power of art to move people, especially during times of crisis. I know you have a long history in the arts. You began your career on Broadway with roles in The Music Man and The Book of Mormon. You obviously originated the title role in Dear Evan Hansen. But this is a really tough time for the creative arts community. A lot of shows are on hiatus, productions have been suspended. And I want to bring in a question from one of our viewers, D in the US, who asks, what does the future of art look like, and how can we make sure it doesn't disappear?
I think that's a great question. I'm feeling very heartened by the fact that so many people have been continuing to produce art. And I think in times of crisis or in times of hardship, if anything, it sort of lights a fire under everybody's butt to create more art. I think people have more that they want to say and write about, and have a greater need to connect than ever. So I would hope that if anything, this will create some sort of a renaissance, and maybe we'll have to adjust, at least for a while, the way that we are interacting in terms of live art and concerts and music and theater. But God willing, even that will return to normal. But I think in terms of the material that's coming out, I know people are so hungry now more than ever for content and for stories and for escape and for music. And so I'm very hopeful that art's going to continue to thrive in a new way even.
Yeah, so am I. And for people that maybe want to help, are there any organizations you would recommend supporting? I know you've done some work with the Actors Fund.
Yes, very much so. The Actors Fund is very important to me. My boyfriend, Noah Galvin, his father lives in one of the homes that they provide, and they just do an incredible job. And they are taking care of people all over the industry, not just, the top line actors that you're seeing on Broadway and your playbills, everybody in the whole cast, the crews, every part of the industry, the Actors Fund is taking care of. So definitely the Actors Fund. Oh, there's so many worthy organizations, obviously anything to WHO or CDC or, food banks. The LA Food Bank is doing an incredible job. New York as well. You can't go wrong with helping out right now, as long as it's going to somewhere that's going to put the money to action.
And speaking of which, I know you've long been a vocal advocate for the LGBTQ community, especially LGBTQ youth, who are particularly at risk during times like these. What are some ways that you and the people watching this could support that community?
I think just continuing to live as authentically and freely as possible. And I always try never to edit any of my stories or my perspective or the songs or the pronouns or any of that. I try to just be as honest and as forward as I can be with who I am. And my sexuality is a part of that. And I guess I would say just continue to watch the art that reflects you, and listen to the artists that reflect you, and watch the stories that reflect you, and know that there are people like you who are supporting you, even if the people that you are stuck with or quarantined with don't necessarily. There are so many people who do, me included.
Great. That is an amazing message. And just to close it all out, I know you've managed to keep writing and singing and creating even while in self-isolation, but once this is all over, because it will be over, what is one piece of art, a show, a musical, a concert that you are most looking forward to seeing in person?
That's an amazing question. I have two answers. The first would be I want to go back to Jagged Little Pill, which is the Alanis Morissette musical that my friend Catherine Gallagher is one of the stars of. She's giving an incredible performance that got cut short by this, and I really hope that they get back on their feet so she can do it some more. And the other would probably be, I'm really excited to see The Music Man, which is coming after, hopefully, God willing, all this is done, with Hugh Jackman and Sutton Foster. That'll be on Broadway as well. And that's just that was my first job I ever had when I was 9 years old, was to be in Music Man. And so that will be such a kind of full circle moment. And it's such a joyful American piece. And I think now more than ever, it's going to be a joy to watch that.
Great. And Ben, thanks so much. I know you have a second song to perform for us today, Grow As We Go, which I'm excited for everyone to hear. So I'm going to stop talking now, and I will turn it back over to you. Thanks again.
All right. Thank you.
You say there's so much you don't know. You need to go and find yourself. You say you'd rather be alone, 'cause you think you won't find it tied to someone else. Who said it's true that the growing only happens on your own? They don't know me and you. I don't think you have to leave. If to change is what you need, you can change right next to me. When you're high, I'll take the lows. You can ebb and I can flow, and we'll take it slow and grow as we go. Grow as we go. Oh. You won't be the only one. I am unfinished, I've got so much left to learn. I don't know how this river runs, but I'd like the company through every twist and turn. Who said it's true that the growing only happens on your own? They don't know me and you. You don't ever have to leave. If to change is what you need, you can change right next to me. When you're high, I'll take the lows. You can ebb and I can flow, and we'll take it slow and grow as we go. Grow as we go. Whoa. Grow as we go. Grow as we go. Whoa. I don't know who we'll become. I can't promise, it's not written in the stars, but I believe that when it's done, we're gonna see that it was better that we grew up together. Tell me you don't wanna leave, 'cause if change is what you need, you can change right next to me. When you're high, I'll take the lows. You can ebb and I can flow, and we'll take it slow and grow as we go. Grow as we go. Whoa. Grow as we go. Grow as we go.
Thank you, Ben, for that moving performance. It was wonderful to have you with us. And thanks to all the guests who joined us and offered their insights today. We're also grateful to P&G for supporting this event, the Focus on Equality. We'll do 2 more events, Time 100 Talks on Equality, in the coming weeks. You can get more information about those events and all of our Time 100 Talks at time.com/Time100Talks. Until next time, thanks for joining us. Stay healthy. See you soon.